Hi, this is Leela Maxa, and I'd like to talk a little bit about medical ethics today. And I've spent a lot of time thinking about this during the semester about what constitutes medical ethics, how did it start, what impact did the civil rights movement um, have on this, and just a little bit about myself. I have been in the medical field for 40 years, almost exactly. I entered medical school in 1986, 40 years ago, graduated from the University of Alabama in 1990, went on to Vanderbilt to train for 3 years in internal medicine, followed by Emory, where I trained in cancer medicine at the Winship Cancer Center. And I've practiced in the Atlanta metropolitan area ever since then as an oncologist, and I have been very blessed to be able to take care of women who are going through the journey of breast cancer. So please follow me as I talk about medical ethics through the historical perspective. Why is this important? And the idea of justice in medical care. Where do we get this from? Who framed it? Who shaped it? And the consequence of these historical injustices in the African American population. I'll talk about Tuskegee and Henrietta Lacks specifically. And then kind of just a small focus on African American with breast cancer to just kind of highlight how the injustices have played upon this, both in decrease in research, participation, and just access, which also affects outcomes, of course. So thank you for your time. Historically, and I'm going back to the 1950s, 1960s, and the civil rights movement to point out the injustice and the disparate care between what African Americans receive for health care and what the rest of the population was receiving. To me, this particular quote summarizes this, and it was by Dr. King, and it was addressed to the Medical Committee for Human Rights, which was formed, and this speech was given in Chicago in 1966. Of all the forms of inequality, injustice in health is the most shocking and inhuman. There are several examples of historical injustices that we could discuss, some of which have been discussed in class this semester, such as the hysterectomy on a young lady in Mississippi affecting her reproductive rights without her knowledge. I'd like to discuss a couple today that I think are the most relevant to our discussion regarding cancer care and informed consent. The first one is the Tuskegee syphilis study. The Tuskegee syphilis study was notable because it took place for over 40 years and was called the African American Tuskegee Study for Untreated Syphilis in the Negro Male. And they recruited 600 impoverished males from Macon County, Alabama, several of them who had latent syphilis, and they were observed, treated, sometimes with ineffective therapies, and even after syphilis became the standardly treated with penicillin, they were withheld treatment. And this study continued with multiple leaders of this and multiple organizations, including the CDC. There was no informed consent. There were false treatments. Some of the consequences were that 100 men actually died as a result of syphilis, either directly or indirectly, after penicillin was available widely. And there were partners of these men that were infected and children born with congenital syphilis. The study was terminated with a whistleblower in 1973 by the Department of Health, Human and Welfare. Not surprisingly, this study resulted in a mistrust in medical care for the African American population and reduced research participation, which of course then led to even additional long-term health disparities. The National Research Act was established after this came to light and required informed consent, which we must have now to have anybody participate in any research project. The second example of historical injustice I'd like to discuss also pertains to cancer research and management. and is the case of Henrietta Lacks. Henrietta Lacks was born in 1920, and she was diagnosed with cervical cancer at the age of 31, and she was treated at Johns Hopkins University. Her cells at the time of her treatment, without her consent, were taken out and became the foundation for the famous HeLa cell line. They were the first immortalized human cancer cells and significantly advanced medical research. They were responsible for developing the polio vaccine, breakthroughs in understanding cancer and developing treatments, and also in gene mapping and cloning techniques. The problem is that none of this was done with Henrietta Lacks's or family's consent or knowledge. These were completely unknown to the family and raised ethical concerns about consent for medical research. So the two examples, both the Tuskegee syphilis study and the Henrietta Lacks story, they occurred from 1932 to 1972 with the study, and with Henrietta Lacks, with her cells being taken in 1951. This was in the backdrop of the medical civil rights movement, and with these two egregious examples of medical injustice and serious questions in ethical standards, there were changes that needed to be done, and it was the medical civil rights movement, which really started in the 1940s to the 1960s, that challenged the systemic injustices that were found in these two studies, as well as other examples. I just highlighted these two because they discuss informed consent in cancer and cancer research. But unequal care was no longer acceptable, and not just unequal, but it was just an ethical failure. Dr. King was certainly a leading voice in the movement, as were other people that are less well known, such as Dr. Holloman, Dr. Lear, Dr. Smith, and Dr. Cornley, who fought for desegregated hospitals, established community health centers, established the African American version of the AMA, as well as fought to have African Americans get accepted into the AMA, which is the American Medical Association. I did part of my training at the Grady Hospital, serving the cancer needs of the Grady population. It was built in 1892 with the vision that care was going to be provided at the facility for everybody. However, black and white patients were treated there, but there were separate wings until the 1960s, when really the pressure from the Atlanta student movement and the support of Dr. King led to the desegregation of Grady, which was done on a memo in June 1st, 1965. I'd like to highlight some of these key champions and organizations who are not as well known, but I have mentioned Dr. Robert Smith, who was the doctor to the civil rights movement. He provided care to activists in Mississippi, created community centers, and then also speak to the Medical Committee for Human Rights, which was the medical arm of the movement. So the civil rights movement had a great deal to do with the medical rights movement as well. And I think I mentioned Dr. Holloman and Dr. Lee before. They forced the AMA to desegregate and also participated in the March on Washington. So with this history of distrust, how do we actually address medical ethics? We do so by defining what medical justice is: fair distribution of resources across all populations, addressing systemic inequities, and also talking about the principles of bioethics. An initial attempt at correcting historical injustices was to describe what medical justice looked like. And the initial attempt appeared to be in the Principles of Biomedical Ethics, as penned by Tom Beauchamp and James Childress, with these 4 principles which were created to help guide what medical ethics is, and that's described below in these 4 arms. So we have Beauchamp and Childress in the 1970s, actually the late 1970s, writing about the 4 pillars of bioethics and principles. But I think that, in my opinion, John Rawls and his political philosophy in A Theory of Justice, which was written in 1971, ironically a year before the Tuskegee syphilis experiment was brought to light in 1972, really was the most influential and impressive ethical push for fairness, because his idea was that medical care and other liberties were only just if they were fair. It was a simple principle, but justice is fairness was his idea. And it was done from the veil of ignorance when you were designing a society without knowing your role in it, and that equal basic liberties included health care. And if there was a difference in health care or liberties, that this benefited the less fortunate. He especially thought health care was a primary good, and also that we needed to reduce disparities that were glaring, especially in the examples provided previously, as well as just in the segregation of facilities that had been the case until the 1960s. In addition to the Rawlsian idea, the Catholic social teaching on justice came from a scriptural background, and the Catholic guide to social change came from the belief that all people were made in the image of God and must be treated as such. The Catholic Church's position was that healthcare was not an option. It was not something that was considered a luxury or meant for only certain groups of people. They really brought to attention that human right was also a medical right. There was moral impetus in creating equality in healthcare, and we always have a duty as a society to protect the most vulnerable. And this is done from Jesus's teachings. So I think we discussed this as well in class, that we must integrate several theories to arrive at the idea that we're looking for. The idea that we're looking for here is fairness, and that justice is fairness and equality in healthcare. So that's really what we should be working towards, and this is highlighted by the integration of all these three frameworks. The bioethics, which talks about fairness in care, the provider taking care of the patient, receiving care, a Rawlsian fairness in a system, Catholic teaching, which is highlighting a theological argument, certainly not the only one, but as a moral obligation from a theological point of view. And the healthcare system should prioritize the vulnerable, the marginalized, the people who are being treated inequitably, and make sure that there is dignity for all patients. And justice is both ethical and it is also a moral imperative. So I talked about a couple of these historical injustices, and also that Grady actually had separate wings of their hospital which were not segregated until 1965. What were the results of these historical injustices? I wanted to just briefly discuss three case studies. The first two examples are quick. I just want to highlight that African American women are 2 to 3 times higher with their mortality risk with obstetrics, and it occurs across every single income and education level, and it's really remains unexplained. There are some ideas about why this is so egregious. There's bias in care, delayed diagnosis and treatment, and also unequal access to quality hospitals. The second case study is a bias in pain management. Of course, it's also important in the work I do, which is cancer care. But of course, pain is not specific to cancer, but this was an area of interest for me. And that I found it to be interesting that African American patients are undertreated for pain There are false beliefs about some differences in biology, and also this is actually documented in multiple studies that there is a bias in the way providers manage pain. So with pain management, there's lower prescription drugs, delays in emergency care, and of course the trust issue persists. And then we move on to my area of interest, and it's cancer care. So this third example, to me, and I've highlighted this, African Americans in the United States still face the highest death rate and shortest survival times for most types of cancer compared to any other racial ethnic groups. While all the mortality in the U.S. has declined, Black individuals continue to experience disproportionately poor outcomes. This is per the American Cancer Society. So, again, according to the American Cancer Society, the disparities occur specifically in certain cancer groups. Prostate cancer, Black men face the highest death rate, twice of that of other groups, and are also more likely to be diagnosed. Breast cancer, despite a 5% lower incidence of actually being diagnosed with breast cancer, there's a 40% higher mortality rate than white women, facing higher rates of aggressive subtypes. And endometrial cancer also has a high mortality rate for Black women and lower 5-year survival rates. And that same 40% higher mortality persists for colorectal cancer in African American women and men. Highlighting African American women with breast cancer, basically women are diagnosed at a younger age with more aggressive subtype and with a lag of clarity of guidelines. Problems include being diagnosed at more advanced stages. Even with earlier diagnosis, they're just likely to not receive the standard of care, including the timely and curative treatments. And there is discrimination and distrust, just as we talked about, implicit bias and historical distrust that we are still trying to get past. They face a unique biological and systemic challenges in breast cancer diagnosis, having earlier diagnosis, more aggressive disease, and higher mortalities. African American women are significantly underrepresented in clinical research trials, and we have to work harder to bridge this gap. And also locally, Monica Kaufman Pearson and Dr. Walters have been very vocal with their stories and have been very impactful in our local community. So to answer the first question, what is justice here? Justice here in medical care should be fairness and equity. That's not too much to ask for. It was clearly stated in the 1970s. It was stated both in secular philosophy and religious community. And what is fair in medical care? Was it fair in the 1950s? Was it fair in the 1970s when these discussions started? The civil rights movement had a great deal to do with advancement of desegregation of hospitals, community centers. and championing the equity of medical access and care and outcomes. And the leadership in the future must come from both legislative and moral leadership, and to continue to press on the fairness and equity principles. But as far as which ideas shape this, I personally think that Rawls, as a philosophical background in politics, and as well as the Catholic bishops, really talk about the essential qualities that I think about, which are really treating everybody the same, irrespective of position in society, and also treating the less advantaged people, and it could be the African American women with breast cancer who have, in my mind, an unacceptable um, elevated levels of mortality despite their disease um, stages, and there is room for improvement here. But to me, the Rawlsian idea, which is more secular, and the Catholic bishop's idea, which is really based on the biblical idea of the divinity of all of us being in the image of God, ring true to me the most and are really not contradictory. They work together very beautifully, and I think we should move more towards fairness and equity as defined by Rawls, the